Hello everybody and welcome back to Rebellious Menstruation. Today we are looking at period blood clots and slippery cervical mucousy blood. I'm sure that we've all had that experience of blood clots and slippery, shiny blood that changes throughout our cycle and can change from period to period and from day to day. During your period, the lining of your uterus, the endometrium, is being shed, which means that the actual flow is a mixture of uterine lining and vaginal fluid, along with the blood. This mixture can clump together to form clots. These can come in a range of colours and across the days of your period, just like essentially the blood colour that comes out. However, these blood clots, while perfectly normal, do represent your period health. These small, chunky clots generally happen during heavy bleeding. This is because your body makes anticoagulants to keep your uterine blood from clotting. This is actually an important and vital thing that your body does, and it's important to know the difference why this happens. As your blood circulates through your body, it contains a coagulant, so that when you say cut yourself or have a nosebleed, the blood flow should clot up and stop, hopefully. Of course, we can't have this happening to menstrual blood. It would be a very bad idea if menstrual blood clotted and stayed inside your body. We want it to exit fluidically. Menstrual blood should maintain a sense of viscosity, not too thin, not too thick, or consistency, in other words. During your period, this anticoagulant being produced is to keep your menstrual cycle blood from flowing from your uterus through your vaginal canal and out of your body. However, occasionally the blood leaves the uterus too quickly for these anticoagulants to take effect or be released in time to stop it from clotting. Hence why it tends to happen more on heavier days. This blood, mixed with endometrium, is then subjected to the body's usual reaction to blood, which is forming clots. Hence why you will clot on heavy days or fast bleeding days, predominantly over slow bleed days. And this is actually perfectly normal. As stated before, it's the blood flow from your body going too quickly. However, these actual blood clots should technically be smaller than 20 cent to 50 cent piece. If they are particularly large, please see your GP or your gynecologist or a sexual health clinic, because obviously the space in between your cervix and exiting your body should not be large enough to produce massive blood clots. Sometimes this does happen. On occasion it can be normal. People have seen their medical profession about that and been told it's fine. So obviously you know your body. So the slippery menstrual blood represents the exiting menstrual blood collecting cervical mucus in the vaginal canal. The vaginal canal between the vulva and the cervix contains these mucus-producing cells. This mucus functions for several reasons, and they're not necessarily related to your menstrual care. They exist for lubrication, they exist for sperm protection, which basically assists the sperm in fertilizing the egg if you were in that phase of your cycle, and it also can thicken along the wall, along your vaginal wall, and exclude sperm on occasion to actually assist your body in not getting pregnant, which is sometimes why on the pill you can actually have an excess of mucus in your vaginal canal that may cause issues. But so it does, they're just some of the reasons that the vaginal canal mucus exists and the glands exist along the wall. But it can also mix with your menstrual cycle, causing a slippery and shiny blood, and you'll notice this. Like if you're wearing external protection, you will notice this. I've got this shiny blood before, and sometimes when you take out your menstrual cup, the menstrual cup actually can be shiny because it's been sitting against your vaginal wall, but also the blood can be a little bit viscousy. So, so the blood can mix with this mucus and cause a slippery and shiny blood situation. This is actually no cause for alarm. The best judge of whether this is a concern or not is actually you, as you are with your cycle every single month. You also know what medications you are on. You also know what else is happening with your body and what type of sexual protection you are using, and what you are allergic to or not allergic to. So it is for you to pay attention to, as in your period and your cycle. It is an exceptionally important tool in assessing your health. Both mucus colour and clot appearance can indicate estrogen and progesterone levels in your body, and can possibly be indicative of other hormonal issues. If you have noticed that there is a difference in your clotting or your cycle, or it all of a sudden changes, this is when you need to seek medical attention for that, because you are with your body more than anyone else in the world. So, thanks for watching. Enjoy your morning, afternoon or evening, depending of course where you are in the day, and I will catch up with you all in the next video. Bye everyone.